Good to see you, colleagues. Yeah, let me quickly walk you through a full mock on a patient that is having pneumonia. It's going to be a full assessment, planning, implementation, and evaluation. With that being said, let's dive in. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left thumb, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa, and my hands are clean. I will allow to air dry for 30 seconds as I approach my patient. I'm Kenny, one of the nurses that will be looking after you today. How are you? Right. The reason why I'm here is to carry out a full set of observations on you, following A to E approach, and ask you few questions about your activities of daily living. Is it a convenient time, please? Great. Before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? Good. I have here also Janet James. Janet James, your date of birth is 01/01/1957. 01/01/1957. And your hospital number is 1234567. 1234567. Fantastic. Can I confirm if you're having any allergies at all? Oh, good. It is also properly documented in my notes that you have no known allergy, and that is why you are on white wristband. All right. How may I address you, please? Okay, Janet. I'll be stepping aside now to quickly gather the equipment I'll be using for this procedure, and I'll be back shortly. Here is the call bell. Should you need me, do press on the call bell, and I'll be here to attend to you. Is that okay? All right. So, leaving Janet now to gather the equipment, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. Assessor, could you please confirm the equipment are clean, calibrated, and are ready for use? All right, thank you. All right, Janet, I'm back. Are you still happy for us to continue, please? Okay, so I'll be starting by checking your blood pressure. Which of the two arms would you prefer the cuff to be tied on? Oh, great, the left one. All right. So, can I confirm if you've been resting in the last 20 minutes? Oh, good. And I can see obviously your legs are not crossed. Fantastic. Could you please confirm with me if you've had any surgery done on this arm? Oh, good. And I can see the arm is visibly clean. There's no sign of inflammation such as redness, swelling, or bruises. Yeah, I'm happy to tie the cuff. So I'll be tying the cuff about 2 to 3 centimeters away from the cubital fossa, making sure it is not too tight and it's not too loose. However, as soon as the machine starts working, you may feel a little tightness on your arm. Do not worry, it's going to be for the time being. Is that okay? All right. So while the cuff is tied to your arm, I'm not going to start the machine immediately. Is it okay to touch your other arm, please, to check for your capillary refill? Okay, good. So I can see the nails are visibly clean. There is no signs of infection, no skin lesion, no inflammation of any kind. So I will be depressing your fingers for 5 seconds to check for your capillary refill. Is that okay, Janet? All right. 1, 2, 3, 4, 5. Yeah, your capillary refilled in less than 2 seconds, which is great. So I will go ahead now and put the probe. Okay, so I will start the machine immediately. Your blood pressure is 138/80 millimeter of mercury, and your SpO2 is 89% on room air. Right. So I will be unwrapping the cuff now. Okay, and keep it aside as well as the pulse oximeter. I will be cleaning them when I'm done with the procedure. All right. So in the next 2 minutes, Janet, I would want us to be silent. I will not be talking to you this time. I want to check your heart rate. Is that okay? All right. So I will go ahead now and palpate Janet's radial artery to check for the pulse. Assessor, my time starts now. All right, Janet, I'm so sorry. I actually counted your heart rate for 1 minute, and the remaining 1 minute, I counted your respiration. I was intentional about not informing you so that the reading does not get altered. I'm so sorry about this. Thank you very much. Okay, so here is an infrared thermometer. It's a device that is used to check temperature. It's not going to harm you, neither will it come directly in contact with your skin. All right, so it's just to check your temperature. Are you happy for me to use, please? Okay, checking Janet's forehead. There is no excessive sweating, no skin lesion, no inflammation of any kind. So I'm happy to check Janet's temperature. Good. Your temperature is 38.3. All right. That brings us to the end of the full set of observation. Thank you very much. So, moving on to A to E assessment now. Since the procedure began, you've been talking to me in full sentences. So, I don't want to assume your airway is patent that way. To further establish this, could you please make a cough, Janet? Good. Can you take a deep breathing breath as well? Fantastic. Assessor, I can confirm Janet's airway is patent. All right. Moving on to B, which is your breathing. The other time I checked for your respiration, the rate and the depth, your respiration was 24 cycle per minute, which is slightly elevated above the normal therapeutic range. This is not to frighten you. That is why you are in the hospital, and we're going to take care of that and it will become normal again. Is that okay? Depth was not too shallow. However, it wasn't at the rate we expected it to be. But do not worry, like I said, it's going to be well taken care of. Is that okay, Jeanette? All right, thank you. Still on the breathing, talking about respiratory noises such as rattle, wheeze, stridor, or coughing. None of this sound was heard during the assessment. Moving on to visual signs of respiratory distress, such as the use of accessory muscle. Obviously, you were using your accessory muscle to breathe because you're not breathing at ease now. Okay, but do not worry, like I said, we're going to take care of that. There is no seesaw breathing, there is no cyanosis, so I'm happy about that. Talking about your air entry, the rising and falling of your chest is happening at equal rates, meaning there is equal air entry. So there's no problem about that. Okay. Moving on to your oxygen saturation level, you're saturating on air and your SpO2 reading was 89%. It is slightly subnormal. Do not worry, we're going to be taking care of that. Is that okay, Jeanette? So moving on to C, which is your circulation. The other time I depressed your fingers for 5 seconds to check if you were properly perfused. I'm happy because your capillary refilled in less than 2 seconds. It does mean you are properly perfused. I'm happy about that. Okay, moving on to your blood pressure. Your blood pressure was 138 over 80 millimeter of mercury. That is okay, Janet. Also, your heart rate was checked. You are having a heart rate of 102 beats per minute. That's a little higher than the normal. Do not worry. Stating all of these values is not to frighten you, but you just need to be carried along in your care. Is that okay, Janet? All right. The strength and the rhythm of your pulse was okay. Right. Moving on to D. Janet, do you know where you are at the moment? Oh, good. You're actually in the hospital. Fantastic. Do you know what time of the day it is? Good. It's actually a noon time. Yeah, well done, Janet. Do you know who I am? Good. I'm actually your nurse. Right. So it does mean you are properly oriented to time, place, and person. That's good to know, Janet. Okay. Can I confirm with you the last time you visited the loo? Oh, good. About an hour ago. Yeah. Do you experience any pain using the loo? Oh, fantastic. That's good to know. None. All right. So, assessor, could you please confirm with me Janet's blood glucose level and the last time it was checked, please? Oh, great. It was checked at early hour of today and it's within normal therapeutic range. Yeah, that's a good news, Janet. I'm quite happy with that. Okay. So could you please confirm with me, Janet, if you are having any pain at the moment? Oh, so sorry to hear that. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain? Oh, you would say 7. That's quite high. Assessor, Janet seems to be in a lot of pain now. If it were to be a real clinical scenario, I would have loved to stop what I'm doing now and attend to Janet as she seems to be in a lot of pain. But for the purpose of the exam, could you please allow me to continue? All right, thank you. So sorry, Janet. Could you please point to where exactly the pain is? Oh, on your chest. So sorry to hear that. Is it okay to be taking deep breathing breaths, Janet? So sorry to hear this. Can I reposition you to sit up properly? Oh, so sorry. So sorry, Janet. Can I place the pillow behind you? All right. Do you feel any better? Oh, no improvement still. Do not worry. I'm going to be checking through your match chart in a moment to see if you are due for any medication and it's going to be administered to you. Is that okay? And if not, I'm going to be escalating your care. And as soon as medication is prescribed, I will return to administer to you. Is that okay, Jeanette? Can you still manage, please? So sorry. Are you still happy for me to continue? All right. I will be as quick as I can. Is that okay, Jeanette? All right. So moving on to P, which is the exposure. On the part exposed on your body, I cannot see any sign of bleed, bruise, or injury. Could you please confirm if any part covered, if there is any of these signs there, please? Oh, none. Fantastic. I'm happy about that. And the other time I checked your temperature, it was 38.3. It is slightly subnormal, but do not worry. Everything is going to be taken care of. Is that okay, Jeanette? All right. That brings us to the end of A to E assessment. And you've got no past medical history. So I'm going to be stepping aside now to quickly document my findings, and I'll be back in a moment to relay the findings to you. Is that okay, Jeanette? Here is the call bell in case I'm away and you need anything. Okay, do press on the call bell and I'll be here to attend to. Is that okay, Jeanette? All right. So leaving Jeanette now to document, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, Janet, I'm back. Following the assessment that was done on you, I came up with a total new score of 7. Do not be scared. It is nothing to worry about. We are in safe hands and will do our possible best to make sure every of these parameters are back to normal. Is that okay, Janet? Okay. You were having those scores on SpO2 where you had 89%, you were having a score of 3 on that. You are having a total score of 7, mainly because of your low oxygen saturation and the raised respiratory rate. Though you are alert, but you are showing significant sign of respiratory compromise. Do not worry, I'll be escalating to the medical team and oxygen will be commenced as soon as possible according to the hospital protocol. Is that okay, Janet? All right. A quick one on your activities of daily living. Okay, so talking about the physical aspect of it now. So if I may ask, how do you mobilize, Janet? Hmm, so sorry about that. So if I heard you correctly, Janet, you said you could only mobilize within short distance due to increased breathless on exertion. I can imagine how uncomfortable this situation may be for you now, but do not worry. We're going to take care of that. Is that okay, Janet? All right. So, Janet, if I may ask, can you wash or dress up yourself properly? Oh, so sorry to hear this. Hmm, I understand. Yeah, it could be so distressing. Okay, so if I heard you correctly, you said you would need ends doing your washing up because you find it difficult due to fatigue to do that yourself. So don't worry, Janet. With your permission, we are going to be arranging social workers to help you in this aspect, if that is okay with you. All right. Are you eating and drinking all right, all by yourself, if I may ask, please? Oh, so sorry to hear this. Yeah, I'm so sorry about this, Janet. I understand how you're feeling. Yeah. So if I heard you right, you said over the last few days your appetite has dropped and you've not been able to eat well, though you feed yourself, you do that independently, but though you've not been able to take in much. Is that what you mean? So sorry about this. Okay, with your permission, is it okay to talk to the dietitian about this? All right, Janet, no problem. Everything is under control, okay? All right, Janet, moving on to you, psychosocial. I could read from your notes that you live alone in a single story home. Is that correct? Right. How is running errands with you, Janet? Oh, good to know that. All right, good. So your daughter comes occasionally to assist you with chores. That's good to know, Janet. Okay, what a great daughter you've got. Well done. Right. Moving on to your religion. Do you practice any religion at all? Oh, good. All right. So you are a Christian and you go to church. Good to know that, Janet. Right. Well done. Okay. Do you want to discuss anything about your sexual life? Oh, not at all. That's good. That's okay, Janet. Yeah. Apart from all of this we've discussed, have you got any questions for me? Oh, good to know that. Thank you so much for your time. That will be all for now. Here is the call bell in case I'm away and you need anything. Do press on the buzzer, and one of the members of the team will come to attend to you. Is that okay, Janet? Thank you very much. So, leaving Janet now. So, I will be cleaning the reusable equipment in preparation for the next use. Then I go ahead and perform my final hand hygiene, following the 7 steps of WHO standard. All right, colleagues, it could be that simple. That brings us to the end of the full assessment for Janet, who is having pneumonia. I will see you shortly in planning station. But before then, it is a good news, colleagues. We just got this channel partially monetized. It wouldn't have happened without your support. I appreciate everyone for the huge support. Thank you so much. Now that we are partially monetized, what it means for you is and step up your membership from being ordinary subscriber to being a member of this channel. And there are exclusive perks for the channel members. Yeah, such as you will be the first set of people that would decide through poll which video you would want to see next. You'll be the one to see every video first, and there will be some behind the scene that will not be discussed openly that you will have access to in that membership only videos. As a member, your comment will be prioritized. Yeah, we will attend to your comment first. Any of your question will be attended to first before every other person. And lot more, just to mention but a few. Having said that, how you can go about it is just to click the join button and you will be one of the members of this channel. Thank you so much. Now, let's go and write 2 care plan for this patient. Yeah, it was hot as usual. Yes. So I came up with 2 nursing care plan. Yeah, the first one is Janet is experiencing breathlessness due to pneumonia with SpO2 of 89% on room air and respiratory rate of 24 cycle per minute. My aim of care is Janet will maintain normal oxygen saturation level and breathing pattern of between 12 to 18 cycles per minute following nursing interventions. The reevaluation date is today, the exam date in bracket open and close, every 30 minutes or sooner if the clinical condition changes. The nursing interventions now. The first one is explain and discuss all aspects of care to Janet and obtain informed consent. The next one, monitor and record Janet's vital observations every hour, especially her oxygen saturation level, respiration, and temperature escalating as per News 2 policy. Next, assess Janet for sign of breathlessness such as use of accessory muscles, excessive sweating, or cyanosis, especially on lips and fingers. Next, assess type, color, and amount of sputum. Next, start oxygen as prescribed. It could be nasal cannula, that is 1 to 2 liters per minute. Sit Janet upright, that is high Fowler's position, to improve lung expansion. Next, encourage slow, relaxed breathing and effective coughing. Next, educate Janet on why oxygen is needed and target range to prevent hypercapnia. Next, administer prescribed medications, monitoring effectiveness and side effects after 30 minutes. Next, refer Janet to physiotherapy for proper package of care, which include breathing exercises, airway clearance techniques, and mobility assessment. Next, demonstrate and inform Janet on the use of cowbell. Finally, on that note, document all aspects of care as planned. If it is not documented, it is not done. Yeah, this is the first nursing care plan. Simple, innit? Yeah, moving on to the second nursing care plan now. Janet is experiencing activities intolerance due to low oxygen saturation and breathlessness. The aim of care is Janet will be able to perform essential daily tasks like washing, dressing, and mobilize safely following nursing interventions. The reevaluation date is today, exam date in bracket open and close, every 4 to 6 hourly. You want to space it this way so that the patient will not feel unease. You can't do it like every 30 minutes. You want to space it this way so that you don't go there often, so that the patient will not be stressed out. Yeah. So for the interventions now, you're going to explain and discuss all aspects of care to Janet and obtain informed consent. Next, you monitor and record James' vital observations, especially respiration and oxygen saturation level, every hour and escalate as per News 2 policy. Next, ask Janet how tired she feels before, during, and after tasks. Observe if she needs to stop activities, rest, or sit quickly. Next, teach Janet pursed lip breathing, that is, breathing in through the nose and out slowly through pursed lips to control breathlessness. Next, teach Janet on slow, steady breathing during activities. Next, educate Janet to sit upright or lean forward, that is, in a tripod position when breathless. Next, teach Janet to avoid bending or sudden movements that worsen breathlessness. Next, teach Janet to drink plenty of fluids, to keep sputum thin, also eat small but frequent meal to avoid fatigue. The next one, administer prescribed medications to Janet, monitoring effectiveness and side effects after 30 minutes. Refer Janet to occupational therapy team, physiotherapist for proper package of care. Next, demonstrate and inform Janet on the appropriate use of cowbell. Then finally, document all aspects of care as planned. You have successfully written 2 valid nursing care plans. I never said this is the best, but it could be of use to you in your exam. I will see you shortly in implementation station, where we will be administering due medications for Janet. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left bosom, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow it to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be looking after you today. How are you? Right. The reason why I'm here is to administer your due medications for 800 hours. Is it a convenient time, please? Oh, great. Before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? I have Janet James. Janet James. Your date of birth is 01/01/1957. 01/01/1957. Good. Your hospital number is 1234567. 1234567. Fantastic. How may I address you, please? All right, Janet. Okay, assessor, I can confirm I am with the right patient and I'm happy to proceed. Okay, Janet, do you have any allergies at all? Great. It is properly documented here that you have no known allergy. Okay, and with the evidence of white wristband on your hand. Okay, yeah. All right. So is it okay to take you through your medication chart, please? Oh, good. So I have the hospital chart for Janet James. The date of birth is 01/01/1957. The hospital number is 1234567. The ward is general ward. The date of admission is today. The height is 1.57 inches. The weight is 74 kilograms. The body mass index is 25.6. The consultant name is Dr. Tolu. The time of admission is 800 hour. Under the prescriber details, I have the name Dr. Tolu. The GMC number is 123. The signature is properly appended and the blip number is 123. Under the details of the person administering the medication, which is me, I'll be coming back to document my details on this page appropriately. Under the alerts and allergies, Janet does not have any allergy and the box no is properly ticked for Janet. Under medication risk factors, there is no medication risk factor ticked for Janet. I move to the next page. I still have hospital chart for Janet James. The date of birth is 01/01/1957. The rest of information on this page is as the same as the previous page. I've read and understood the code and if need be, I will come to use appropriately. Moving on to once only medicine. There is no once only medicine documented for Janet. I move on to the next page. I still have hospital chart for Janet James. The date of birth is 01/01/1957. The rest of information on this page is as the same as the previous pages. And the set target is 94 to 98%. The device is Venturi 28. That is 4 to 6 liters per minute. It has been commenced by a senior colleague. It's ongoing. So I will be coming to check if the patient is meeting the set target. Right. So I move on to the next page. I still have hospital chart for Janet James. The date of birth is 01/01/1957. The rest of information on this page is as the same as the previous pages. Under antimicrobial, the drug is amoxicillin. The date is today. The dose is 500 milligrams. The frequency is 3 times daily. The route is per oral. Duration is 5 days. The time is 800 hour, which is my time. The start date is today. The finish date is plus 4 days. The prescriber signature and blip is properly documented, Dr. Tolu, and the blip number is properly documented as well. It is a valid and legible prescription, and my patient is not allergic to penicillin. I'm happy to administer amoxicillin. All right, Janet, what amoxicillin does in your case, because you are having a community-acquired pneumonia, that is why it is prescribed, okay? And some of the side effects you may or may likely not to manifest include, and not limited to, nausea, vomiting, headache, or dizziness. Are you still happy for me to administer the medication, Janet? Okay, good. So I will not be signing the medication now. I will come back to append my signature after I might have administered the medication to Janet. All right. There is no other antimicrobial prescribed for Janet. I move on to the next page. I still have hospital mark chart for Janet James. The date of birth is 01/01/1957. The rest of information on this page is as the same as previous pages. Under regular medicine, I have paracetamol. The date is today. The dose is 1 gram. The frequency is 4 times daily. The route is per oral. The duration is 3 days. The time is 800 hour, which is my time. The start date is today. The finish date is plus 2 days. The prescriber signature and blip number is properly documented. It is a valid and legible prescription. Paracetamol has not been given under once only. It's not been administered in the last 4 to 6 hours. All right, Janet, can I confirm if you are still experiencing any pain? Oh, so sorry to hear that. On a scale of 0 to 10, 0 being no pain and 10 being the worst pain possible, how would you rate your pain, please? Oh, you will still say 7. Okay, that's still quite high. You are due for analgesics now, paracetamol. Okay, and it's not been administered to you in the last 4 to 6 hours. Am I correct? Oh, good. So I'm going to be administering to you now. Okay, is that all right, Janet? So paracetamol, what it does is, it is to relieve you of mild to moderate pain. Okay, and some of the side effects you may or may likely not to manifest include, and not limited to, nausea, vomiting, or abdominal disturbances. Are you still happy for me to administer, please? Oh, great. So I will not be appending my signature now until after I might have administered the medication. All right. There is no more regular medicine prescribed for Janet. Yeah. So I will move on to the next page. I still have hospital mark chart for Janet James. The date of birth is 01/01/1957. The rest of information on this page is as the same as previous pages. There is no medication documented for Janet under as required medicine. I will move on to the next page. I still have hospital mark chart for Janet James. The date of birth is 01/01/1957. The rest of information on this page is as the same as previous pages. Under infusion, there is no infusion prescribed for Janet. On the omitted page, if there is any reason to omit any medication, I will come to document properly on this page. Okay, so thank you very much, Janet. And that brings us to the end of the chart review. I will be stepping aside now to quickly prepare the medications, and I will be back shortly. Where is the call bell, Janet? I will be stepping aside now to prepare the medications, and I'll be back shortly to attend to you. All right, thank you. So, leaving Janet now to prepare the medications, I will go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, assessor, could you please confirm the medication cupboard is under lock and key and will only be opened for the purpose of this medication administration? Oh, thank you very much. I have on my hand amoxicillin. The stock dose is 500 milligram. It is not expired, it's still in date. The expiration date is February 2026. I'll go ahead and compare that with my chart to be sure it's the same medication that is prescribed. So comparing that with my chart, is the same medication that is prescribed. Amoxicillin is also prescribed and the dose is 500 milligram. It does mean I will be dispensing one capsule from the container in an aseptic manner. So in an aseptic manner, I will be opening the container and I will dispense carefully one capsule to the lid and from the lid to the pot. And I will secure the bottle and keep it aside. Prior to every medication administration, the 6 rights needs to be ensured. That is, the right patient, the right medication, the right dosage, the right route, the right time and date, the validity of the prescription, and the proper documentation. I have all the 6 rights in place and I'm happy to proceed. The second medication is paracetamol. I have paracetamol on my hand. The stock dose is 500 milligram. It is not expired. The expiration date is February 2026. I will go ahead and compare that with my chart. It's the same medication that is prescribed and the prescription says 1 gram should be administered. It does mean I will be dispensing 2 tablets of paracetamol from the container. Right. So in an aseptic manner, I'm going to be opening my container and dispense 2 tablets of paracetamol to the lid, from lid to the pot. I'll go ahead and close the medication bottle. Okay, so having done that, I will perform my hand hygiene now, following the 7 steps of WHO standard and proceed back to my patient. Right, Janet, I'm back. Are you still happy for us to continue, please? Good. Before we move on, could you please reconfirm your name and date of birth while I double check with my paperwork as well as against your wristband, please? Okay, I still have here Janet James. Janet James. Your date of birth is 0101-1957. 0101-1957. Your hospital number is 1234567. 1234567. Fantastic. Right, assessor, I can confirm I am with the right patient. Okay, so the other time you said you don't have any allergies. Am I correct? Oh, fantastic. Right. Can I confirm with you if you have difficulty swallowing? Oh, great. None at all. Okay. Do you have nausea at the moment? Good. Right. Do you want your medications together or separately, please? Or you want them together? Right. Good. You want them with water or squash, please? Oh, water. Fantastic. Right. Do you want the water first or medication first? Water first. Okay. Here is the water. Yeah. And here is the medication. Good. Could you please confirm you have taken the medication by opening your mouth, please? Good. So, assessor, I can confirm Janet has safely taken her medications. Okay. So, I'll be stepping aside now, Janet, to quickly document what I've given to you. And I'll be back in a moment. Is that okay? Here is the call bell should you need me before my arrival. Is that all right, Janet? Okay. So, I'll go ahead now and perform my hand hygiene according to 7 steps of WHO standard. So here is the call bell. I will be leaving you now. In case of anything at all, just press on the call bell and we'll be here to attend to you. Is that okay? So I'll go ahead now and lock the medication cupboard and keep the key in place of safety. I will clean the pots in preparation for the next use, then go ahead to perform my final hand hygiene following the 7 steps of WHO standard. Yeah, that's it, colleague. It could be that simple. Easy peasy, isn't it? I will see you shortly in evaluation station where we'll be handling over this patient together. Stay tuned. I am Kenny, a nurse from General Ward, I'm handling over Janet, 68-year-old woman, admitted today with community-acquired pneumonia. Janet is currently stable and showing improvement after treatment, but remains unwell and requires ongoing oxygen and monitoring. For the background, Janet presented with a 3-day history of cough producing yellow sputum, fever, and increasing shortness of breath. Janet has no past medical history and takes no regular medications. She has no known allergy. She lives alone in a single-story home. Janet is independent with all activities of daily living prior to admission. Upon Janet's initial assessment following A to E approach, she had a total NIL score of 7, respiratory rate of 2, SpO2 3, heart rate 1, and the frequency of monitoring was continuous. Moving on to assessment now. The most recent assessment for Janet includes respiratory rate 24, that's having a score of 2, the SpO2 95% now, score of 0. On oxygen, the temperature is 38.2, score of 1. Heart rate 104, that's score of 1. Blood pressure 128/80 of mercury, score of 0. Initially, Janet's NIL score was 7 due to low SpO2, high respiratory rates, and fever. After starting oxygen and reassessing, her SpO2 improved to 95%. Respiratory rate and heart rate dropped slightly, and temperature reduced. The NIL score reduced to 3 from 7, showing she is responding to treatment. However, she still needs continuous monitoring. 2 nursing problems were identified for Janet. First, Janet was experiencing breathlessness due to pneumonia with SpO2 of 89% on room air and respiratory rates of 24 cycles per minute. Her vital observations were monitored, especially SpO2, temperature, and respiration. She was commenced on oxygen and was nursed in an high Fowler position to improve lung expansion. Due medications were administered. Effectiveness and side effects were monitored. Janet was subsequently referred to physiotherapy team for proper package of care. The second nursing problem identified is Janet was experiencing activity intolerance due to low oxygen saturation and breathlessness. Her vital observations were monitored. She was taught breathing through a pursed lip to control breathlessness, as well as to assume tripod position or sitting upright while breathing. Janet was educated on the importance of plenty fluid intake, as to keep the sputum thin, also to eat little but often meal to avoid fatigue. Due medications were administered. Effectiveness as well as side effects were monitored and was subsequently referred to occupational therapy team, physiotherapy for further plan of care, and was subsequently referred to occupational therapy as well as physiotherapy team for further plan of care. Moving on to recommendation now. I would recommend you continue oxygen therapy via 28% Venturi mask and titrate to maintain SpO2 of greater or equal to 94 to 98%. Repeat full set of observations and NILS 2 every 30 minutes initially, then hourly if stable. Escalate to medical team if SpO2 drops below target or News 2 increases. Maintain hydration with prescribed IV fluids. Administer our medications when due and watch out for any signs of deterioration, such as increase in respiratory rates, confusion, or new onset of chest pain. All right, that will be all from my end. Do you have any question for me? Right, thank you. Do not hesitate to contact us should you need any further enquiries regarding Janet. Thank you. It could be that simple, colleagues. Yeah, that brings us to the end of APIE for a patient that is having pneumonia. I will see you in my subsequent videos. Should you need one-on-one classes regarding your OSCE, you can contact us through the details that is displayed on your screen, and we will do our bit to assist you. Until I come your way again in my subsequent videos, keep practicing OSCE. Bye.